Pharmacology on Unit 3 and 4, but this general anesthesia, particularly from Unit 4 and bit B in Unit 4 in your syllabus, PCI syllabus, bit B, general anesthesia. So already I taught in another video, so that is technically somewhat faulty. So little bit again I will repeat that one. So be careful on this video and listen carefully. So here first, what is anesthesia? Anesthesia are the group of drugs which we are using or doctors are using, anesthetic technicians are using for operation purpose, before operation, to close the activeness of the body and to reduce the pain actually. So which organ they are going to complete operation, so they have to maintain that one in a senseless manner. So for that reason using anesthetics means this is the reversible loss of consciousness, in any organ. Why reversible loss of consciousness? Because reversible loss means it after completion of the operation or surgery it should be again reversed, so it could be properly work. So now we will see about the general anesthetic mechanism, how it is working. So the main site of action of anesthetic is reticular formation. This is the part in brain actually, CNS. So particularly general anesthetics are worked on CNS. So this is reticular formation happen in brain, particularly brain stem. So this is in rough diagrammatically if you are drawing the brain. So here this here thalamus, hypothalamus, here hypothalamus, thalamus is there, and here midbrain, and this one bones, medulla oblongata at last. So this part is called as brain stem. This part is brain stem. Okay, so in short I am writing here DS. So in this part, here in thalamus and hypothalamus, reticular formation will occur like this. Means it is the network of connected nerves. So that is called as reticular formation. So which normally maintains a state of consciousness. So by forming nerve networks in brain, it is maintaining the consciousness of our activity. Means I am now giving the lecture, means I am in conscious state, so it is maintaining the state of consciousness. So brain forming in CNS, reticular formation occurring, and it is maintaining the consciousness of the brain. So when we are using general anesthesia, GA, general anesthetic agents, okay, so here general anesthetic agents are agonist drugs like GABA, this is natural inhibitory neurotransmitter, and glycine, dopamine. So when we are using general anesthetic, these are depressing that reticular formation, So here most anesthetics depress reticular formation. So if this reticular formation is blocking, by that way it is making the body inactive. For that particular organ we have to transplant like eye or heart surgery, okay, or kidney surgery. So for these things we need general anesthetic agents to apply. So for that purpose we should block the reticular formation, inhibition of the reticular formation. Okay, so by enhancing the activity of inhibitory transmitters means enhancing this GABA's action potential and blocking activity of excitatory transmitters. What are the excitatory transmitters? One example is acetylcholine, very easiest example. So excitatory transmitters always doing activity in our body, okay, contractions, relaxations, and this is in a nature of inhibitory mode. So this is the mechanism in stepwise, okay. So this is man-made barbiturates. Barbiturates are the drugs which working as GABA or which enhancing the GABA receptor, which enhancing the GABA neurotransmitter. So GABA is the full form of gamma aminobutyric acid. Okay. So these are the some drugs: thiopentone, sodium, and methohexitone. These type of drugs, particularly thiopentone, sodium, mostly we are using for induction of the anesthesia. So thiopentone, sodium, and methohexitone, these type of drugs we are using, and these drugs are binding to the GABA receptor, and GABA receptor is pentameric shape. I will show that one later. Okay, pentameric shape, and it is having alpha, beta, and gamma subunits. Two alpha subunits, two gamma two alpha subunits, and two beta subunits, and one gamma subunit. So in GABA is having separate one site, and like GABA another site is there. In that site, benzodiazepine and thiopentone, methohexitone, like these drugs, CNS depressant drugs, these are the and general anesthetic drugs, those are binding on that side and increasing the GABA receptors activity. So here GABA receptor, now after barbiturates, application of barbiturates, binding to GABA receptor, and then chloride channel complex forming. Okay, and this is different from BZ binding site, because I already told just now that there is benzodiazepine site in GABA receptor and another one is GABA. So two sites are there. So benzodiazepine. Okay. So next what will happen? Potentiate GABAergic inhibition. So here it is actually inhibited neurotransmitter, I told you. So it is potentiate, means increase its inhibitory action on the CNS. By that way it is making unconsciousness. So if you are getting unconsciousness, then in that particular organ there won't be supplying of nerve sensation. By that way pain is removed. So next, after that one, chloride channel kept open is increased. So here chloride channel is opening and that is increased, and chloride ion conduction is increased. Then membrane hyperpolarization. Membrane hyperpolarization means inhibition, okay, of the neurotransmission. Then CNS will be depressed. CNS means central nervous system's activity will be depressed. Here this is presynaptic nerve. This is presynaptic nerve. So and this is postsynaptic nerve. So at the end of presynaptic nerve always releasing some neurotransmitters. So these are the neurotransmitters here. In this case, GABA or GABA-like medicines or drugs like thiopentone, sodium, or methohexitone. So these are releasing after opening the sodium channel. After opening sodium channel, action potential is induced. Action potential is induced here, and this is calcium also getting inside and dissolving the vesicles of that neurotransmitter, and here releasing. So here GABA or GABA-like medications are released, and here receptors are present on postsynaptic nerve. Then here coming out potassium and chloride are getting in. So by that way here inhibition is occur. Hyperpolarization. So on that effector cell, because if suppose this is kidney, so this is in roughly I can draw. So this is kidney. So here suppose here it is connected. This nerve is connected here. So if here inhibition action is there, effect on effector cell, what will happen? There will be no sensation, because it is what is doing here. It is inhibiting the action of acetylcholine or excited neurotransmitters action. Here it is blocking. So by that way, general anesthetics are working or functioning. Okay. So here certain stages of anesthesia. What will happen here? Stage of analgesia, stage of excitement, stage of surgical anesthesia, stage of medullary paralysis. So after application of anesthesia, these mechanisms will be going on. So first stage of analgesia. That means here pain will be blocked. Means there won't be any pain. There won't be any pain like feeling. Okay. Then next stage of excitement, because your particular one neurotransmitter is only working, so your brain and your body will be excited. Okay. Then stage of surgical anesthesia. Okay. Then here in this stage 3, doctors are doing surgery. Then stage of medullary paralysis, means after completion it may get medullary paralysis, so we should be recover that one. So in stage 1 analgesia, what will happen? The patient is conscious but drowsy. The patient is conscious but drowsy. And analgesia and amnesia, what will happen? Analgesia means lack of pain or pain is totally removed, and amnesia means memory loss, means he won't memorize it that what is going on. So he can't or she can't remember that what is going on. He can't feel any pain. So amnesia, brain's memory cell will be stopped working. Then reflexes and respiration are normal, but reflexes of your muscles or that organ will be normal, because you need blood flow or other things, other mineral supplications or all the things. So reflexes and respirations are normal. Okay, oxygen needed and carbon dioxide should be removed. So for this reason, respiration and reflexes are normal. Minor procedures like tooth extraction. So for in stage 1, what we can do after having analgesia, like analgesic drugs are there, like paracetamol also one type of analgesia. It is actually for fever. Okay, but antibiotic, but as well as it is having analgesic effect also. Then minor procedure, this is in stage 1 we can do minor procedures like tooth extraction, means removing of tooth, and abscess drainage, means some fluid is coming out, so we should remove that one, or any bad fluid is there, so we should have to remove that one. So for that one, so on this stage we should do this one. Then stage of excitement. So this is very dangerous state actually. Why? Because here one particular neurotransmitter action is blocked and another inhibited action is more, so it may be dangerous. Patient loses consciousness, and here patient doesn't have any consciousness, so no response to painful stimuli, and sympathetic activity is increased, and here sympathetic activity is increased. So we can conclude here that after application of general anesthesia, parasympathetic system is blocked, because acetylcholine is responsible for parasympathetic action, so that is blocked. So that's why particular one mechanism is going on, another one is stopped. So here this is the dangerous situation. So sympathetic activity is increased. The patient is excited, talks incoherently, and may shout, means he may shout also, because he don't have that much consciousness that what going on in his body or her body. So, and heart rate will be increased, blood pressure will be increased, pupils are dilated, and muscle tone is increased, breathing is irregular. Then stage of surgical anesthesia. Here 4 plain arm means subcategories are there, so I no need to say about each and every category. So here I am telling the three important points. Respiration becomes regular, muscle relax, pharyngeal, corneal and light reflexes are gradually lost. Then later intercostal muscle are paralyzed. Then stage of medullary paralysis, vasomotor center present in the brain. So here, so vasomotor center, respiration and VMC are, that is VMC means vasomotor center, are depressed. Death occurs within a few minutes. If it is not recovered, then it will happen a stage of medullary paralysis, means this is medulla, and if it is not recovered, then it will make it worsen and patient may die. So within very few minutes it will happen. So we should have to that much consciousness that while dealing with the general anesthetic agents. So this is all about general anesthetics, and classifications are there. General anesthetics like inhalational, parenteral. So both the things we are using. So first is inhalational, I am telling, volatile liquids and gas. Mostly nitrous oxide in gas we are using for inhalational purpose for general anesthesia, and volatile liquids ether, halothane, enfluorine and isoflurane, desflurane, sevoflurane. So these are the inhalational volatile liquids, and gaseous are nitrous oxide. So you should remember these all: general anesthesia and inhalational drugs. And parenteral means which are given through IV. Okay. So inducing drugs means for preparation of the stage of excitement, stage of analgesia. So these stages, inducing drugs, thiopentone, already I told you here, thiopentone, sodium. Okay, then propofol and etomidate. So mostly we are using propofol and thiopentone. Mostly thiopentone is the good drug for general anesthesia. Okay, for inducing through parenteral route. Through parenteral route for inducing unconsciousness, but reversal. It should be reversal. Means it should be after completion of the procedure. It should be recovered. Okay. If not recovered, then what will happen? Already I told you that paralysis, medullary paralysis will occur. Okay. Then another parenteral category is the slow acting drugs. So these are the slow acting drugs. Examples are benzodiazepines and diazepam, lorazepam, midazolam, ketamine, dissociate anesthesia, and opioids, fentanyl, alfentanil, sulfentanil, remifentanil. So these are all about general anesthetics classification, inhalational and parenteral. If you are not getting at this time all the things, you can watch this one again. So no problem. So just listen carefully. So first concentration is more important. Then inhalational anesthetics, these are discussed under the following headings. So already I told you. So what will happen here? Later I'll tell. Okay. So up to this one about general anesthetics, their mechanism of action, and how it is working, how it is making the loss of sensation of pain with consciousness or without consciousness, but mostly without consciousness the procedure will be done. So I hope so that you got this video and topic is very clearly. If you are not getting, you can comment below comment section. Okay. So hope so that you enjoyed this video, and if any doubts if you are having, please make comments and share and like and subscribe. Thank you so much.